My name is Crystal Lewis, and I'll be discussing African American males and hypertension. The mission of public health is to promote physical and mental health, prevent disease, injury, and disability. The advanced practice nurse participates in the essential services of public health. This presentation will show how advanced practice nurses participate in the essential services of public health as related to African American males and hypertension. The learning outcomes. After reading this presentation, the audience should be able to compare and contrast various roles of the advanced practice nurse as related to the population of interest, discuss 3 levels of prevention as it relates to the advanced practice nurse, discuss how the roles of the advanced practice nurse can be utilized within the population of African American males between the ages of 19 to 55 to improve health outcomes. The population of interest is African American males ages 19 to 55 diagnosed with hypertension or at high risk for being diagnosed with hypertension. This population is considered at risk for adverse health outcomes related to barriers that affect access to care, such as poverty, unemployment, and lack of insurance, or low educational level. It's also been found that this population lacks educational healthy lifestyle habits, decreased access to health care, unhealthy behaviors, as well as inaccurate health beliefs. High blood pressure and glucose levels puts this population at risk for developing chronic kidney disease. Diabetes and hypertension are the most common risk factors for developing end-stage kidney disease, with obesity being a main determinant. The most common factors that influence the risk of this health problem within the population of interest is low socioeconomic status, inaccurate health beliefs, and unhealthy behaviors. Such unhealthy behaviors consist of smoking, eating diets high in cholesterol, and an overall sedentary lifestyle. There are different aspects that come together to create a higher risk for this population. The environment, genetics, and social determinants. So our environment, the unhealthy diet, the physical inactivity, genetics, the fetal programming, and then our social determinants, education level, employment, their occupation, and the access to health care. So we're going to take a look at the impact of hypertension, some of the statistics here. A greater percent of men, 47%, have high blood pressure, more than women, who level out about 43%. High blood pressure is more common in non-Hispanic Black adults at 54%, and than our non-Hispanic white adults, right at about 46%. Blood pressure control with medication is higher among non-Hispanic white adults at 32%, and in non-Hispanic Black adults, it's about approximately 25%. High blood pressure is more prevalent in the South and Eastern areas of the United States for adults age 20 years old and older. And as well, in 2017, 41% of Alabamians reported having high blood pressure. We're going to look at levels of prevention. We have primary, secondary, and tertiary. Primary prevention is used to promote health and prevent the development or the predisposal to particular conditions. In secondary prevention, it's used to stop the process of disease by early detection and treatment. While as in tertiary prevention, we're looking at stopping deterioration or a relapse or disability and the overall dependency in a patient by an anticipatory nursing and medical care. The advanced practice nurse utilization with populations of interest. In this population, the advanced practice nurse will serve as educator, advocate, and a referral source. As an educator, the nurse educates appropriately based on the client's level of understanding. So they want to teach on a level appropriate for the clients, ensuring that the information can be used by the client. The advanced practice nurse identifies the needs of the community. They implement educational activities aimed at changing behaviors over time. And in this role, they link clients with healthcare providers and needed services. They, along with the individual, assist clients in identifying services needed with the least amount of financial strain to the individual. Another role they play is to assist communities and populations to identify and find in finding services that will increase the overall health status of the population. As an educator, the advanced practice nurse plays a major role in assessment of the literacy of clients. They must be culturally sensitive and be aware of specific areas of unique problems for clients. Healthcare workers are often under the impression that when a client nods that their head means they understand what has been said. This is often not the case. Um, Being illiterate does not mean a person is mentally slow. It means that they basically process information at a different rate. The advanced practice nurse role in prevention is to be culturally sensitive, create educational health fairs, educational brochures, uh, do weight management classes. In secondary prevention, they look more at screening for disease progression and taking preventive measures in order to limit further complications. So they're going to be a unique referral source. They would put together cholesterol screening, glucose screenings, as well as smoking cessation classes. In the tertiary prevention, we're going to look at telehealth visits for our patients. We're looking at treating comorbidities such as diabetes and hyperlipidemia, as well as obesity. So that would be our diabetes management, diet and exercise programs as well. There are several screening tests for hypertension. We would measure clients' blood pressure in clinics. If you're 40 years or greater with multiple risk factors, we'd like to screen you annually. And if you're age 18 to 39 with no risk factors, rescreening every 3 to 5 years is adequate. You can do electrocardiograms, urinalysis, echocardiograms, blood chemistry such as glucose, creatinine, and cholesterol levels. Some of the costs for a screening test can range anywhere from $54 up to $2,000. The effectiveness of those screening tests is early intervention. It reduces the incidence of stroke, reduces the incidence of coronary heart disease, and reduces overall mortality. And it can be a predictor of comorbidities. Screening consequences, there are benefits. The benefits to early testing and screening for hypertension are reduces the risk of stroke, reduces the risk of heart attack, reduces the risk of death from cardiovascular accidents. You can also look at the potential harm for screening consequences, possible financial harm, lost wages for attending doctor's appointments, or increased debt for numerous bills for medication or screening tests or hospital visits. The overall cost to patients could mean the difference between paying your rent and paying for needed health services. Information obtained from references from Alabama Public Health, the CDC, Healthy People 2020, to name a few. Thank you for your time and consideration in viewing this presentation.